sciatic nerve assessment and treatment. So now we're going to go a little more long form. I'm going to show you how I would actually treat the issues that we discussed last time and the assessment we did on the tract of the sciatic nerve and where it might commonly be impinged and causing some of that inflammation of that sciatic nerve. So we looked at, just to recap, some of the areas I find that are very common entrapment sites for the sciatic nerve are in the lumbar spine and down towards the lumbar and sacrum area where the nerve starts passing through the hip down into the piriformis and then goes down into the hamstrings where it can get entangled in the hamstrings, and then in the popliteal area where the nerve splits into the tibial and common peroneal nerve. So now, one thing I do want to make sure I also show, just to go back to the assessment for a minute, is the manual muscle testing. So if Amanda was my client coming in with this sciatic nerve pain, and we identified that she was tight in these entrapment sites, so kind of that QL area, we're assuming that it's on the right side. QL area, we have SI joint that could be causing some of those issues. We have piriformis or some of the other deep six. We have hamstring and popliteus. I'm going to manually muscle test those areas and see if they bring about those symptoms again, and just in general, see if maybe they're weak. So we're going to test those muscles, Amanda. So go ahead and flip over onto your back and scoot down a little bit for me. So the first one we're going to do, we're going to start, I always like to start centrally. Normally I find most of the main issues happen centrally. So relax your arms down to your sides. So to test that right QL over here, quadratus lumborum on the right side, I'm going to have her shift her hips over to that right side. We're shortening that QL muscle, and I'm just going to pull her out of that line of tension. So Amanda, go ahead and meet my pressure here. I'm going to stabilize this hip. You trying? So it's weak. Is there any pain there? No. So a lot of the times, if you're doing a manual muscle test and they have some type of tension or sciatic nerve issue in that area, and you muscle test the area that might be causing the pain, there will be symptoms that are recreated. So they will have pain in that manual muscle test. So that was the QL. Now we're going to do piriformis, and just so I'm on this side of the table, I'm going to do piriformis on this side. So we're going to come up here. I'm going to have her in hip flexion, knee flexion, and she is going to rotate this way with her hip, so external hip rotation. So go ahead and rotate in for me. That's very strong. So piriformis, hip external rotation, very strong. And again, it gets a little, for me, it gets a little confusing with the hip if we're doing manual muscle testing up here, because we're looking at what the femur is doing, not necessarily the tibia. So this would be hip external rotation, internal rotation. That's just a side note. Okay, and then we have hamstrings. So it can be kind of entangled anywhere in general in the hamstring. So we're just going to do a general hamstring test. There are 3 different hamstring muscles, but she's going to come in this knee flexed position. Again, we're shortening the muscle, and then I'm just going to pull her out of this area here, and that's also very strong there. And then the last one is we have the popliteal area back here. That test is a little more difficult. I might not actually do the test. It might be more of a palpation. But to do the popliteus, we're gonna come in a little flexion, tibial internal rotation, and I'm just going to pull you out of that position, Amanda. So hold there with your knee. Go ahead and come out just a little bit further. Right there. Internal rotation with the tibia, and that's very strong, and relax. And again, this would be on this other side. I'm just showing you here. So, okay. The other thing I want to make sure that you guys understand, I want to teach this in depth later on, is how can you tell what the cause is of the pain? So we're going to talk about anti-stim for a minute. So manual muscle testing, this pairs well, because one way we can know that we're on the right thing that's maybe causing weakness or pain is by using our hand and applying pressure, or just general having the hand in that area. So pressure on the body, pressure is anti-stem for nociception. Nociception is they're the pain receptors of the body. So an example, if somebody stabs you in the arm, ouch, my first response or reaction is to grab and create pressure on that area. Pressure is going to decrease the pain and the tension that that stab caused. And what can happen is if there's a lot of tension and pain around that sciatic nerve, the body is going to be squeezing on that nerve. A way that we can diminish that slightly is by creating a little pressure. So Amanda, what I'm going to have you do, we're going to retest this QL. And again, this was weak. I'm going to have you put some pressure on your lower back on the right. We're going to see if that changes the test. Match my pressure here. That helps for sure. Now, just because I kind of know what's going on in your body and your terrible pigeon stretch, which would be stretching those external hip rotators, put your right hand on your piriformis, upper glute on the right. Match my pressure here. Way better. That's a neural lock, immediate connection, which really gives us some intel as to what to target. Now, we could do that for the hamstrings and the popliteus, but again, I'm looking centrally focused. So let's go ahead and flip back over, Amanda. So I honestly like fascial releases more now than a lot of the more technical pin and stretch methods like an ART or something like that, which I've actually done a lot of that. But for me, I'm going to find areas of tension, like that piriformis area is super tight here. And hypertonicity is another thing I really want to touch on, but we'll do that in another video because it's a rabbit hole. But I really want to teach that as well, because that's when your body locks a muscle in tension for a specific reason, and you have to figure out what's causing that. But back to releasing, if I'm on the piriformis muscle here, how do I release that tension? Because the piriformis might be constricting that sciatic nerve. All I'm going to do is I'm going to come to an area of tension, and just like previous videos, I'm going to preach this. You're going to create a little pressure and tension in that area. And I would do this on their backs, so there's a little pressure already down. But in general, you're just going to go to different areas. Go ahead and zoom in over here on this. And you're going to create a little pressure, and this is really tight under my fingers, and tension. Now I'm just going to work around. I know where that piriformis is, right? It's coming off of that sacrum and attaching to the femur over here. I'm just creating some pressure and tension all throughout that muscle to relieve some of that tension of that piriformis muscle. And sometimes you might feel like you need to put a little more pressure down. Sometimes you might feel you need a little more tension. But you're going to just come across that whole muscle. You might need different vectors. And this is why I love massage therapy and body work, because it's not only just doing tension and pressure and being step by step doing things, it's interacting with somebody's nervous system. And I need a calm and confident demeanor when I'm working with someone's body, and they need to be relaxed too. If she's holding tension throughout her body, it's going to be really hard for me to try to get those muscles to relax if she's contracting them. But as we're talking, I'm continuing to do this pressure and tension that's helping to reduce the tension in this piriformis muscle. And we're going to come back and we're going to retest some of those weak muscles to see if they improved. And again, if this is the main cause of that sciatic nerve pain potentially, this might recreate some of those symptoms. This might be painful for them. So it's important not to create more pain that's going to create more tension. So make sure that you are very gentle but direct in your release. Okay, so that's feeling much better. If it was the QL, I would do the same thing. I mean, it's tight here. So I would, knowing where the QL is, or just putting my fingers where the tension is, I'm just going to create some tension, some pressure and tension all around that area. And I put up that diagram, I'll put it up again right here, of where the sciatic nerve goes so that you can target the areas around that nerve. Same thing for the hamstrings. Again, I'd have her probably on her back. Tickle, guess what tickle is? It's a nociceptor, it's a pain receptor. So more pressure is better for tickle than stretch. And I'll show an active release as well, because it's a great tool, especially for people starting out. But in general, that feels much better. So for the Piriformis, we'll do that one. Amanda, go ahead and flip over, and we're gonna go on your side, head over here. Other side. So what I'm gonna do is I'm gonna take my hands, well, I guess you need to flip around here a little bit. I'm gonna find that Piriformis muscle. This is kind of an ART move. I'm gonna put some pressure and tension, more tension than pressure, into that Piriformis, and she's gonna actively bring her knee into her chest. All the way, kind of pull it at the ends with your arm. Good, and then back down. So all I'm doing, I'm creating a little pressure, more tension. I can use my other hand to help keep that tension and pressure, and go ahead and pull your leg in. So this is the active part, an active release. And I'm just going with that tissue and then back down. And you can do like 5 to 10 rounds of that or whatever. But for me personally, I've found that the myofascial work is just as, if not more powerful than some of these very precise movements. So let's go back on your stomach down here, Amanda. And this is a simplified version of how to release tension in different spots. But hopefully this is helpful to you in identifying, because sciatica is such a problem that if you can identify, you can assess, and then you can do some type of release on the muscles around the nerve that might be compressing the nerve and causing that pain, I think it could really help a lot of people. So we have low back on one side, we have hip, piriformis, deep 6, we have hamstring, we have popliteus. And one quick thing, if your person's a runner or they have a lot of tension in their calf, or they've had a knee injury, the popliteus will contract to protect that knee joint. That can cause impingement back there and cause some of that sciatica going down into the foot. So go ahead and flip over. I'm going to show 2 quick things and then we're done until the next video. So on this right side, you can palpate behind the knee here. It's a little more lateral, some of that popliteus, and that's where it splits right here, that sciatic nerve. Part of it comes over top, part of it goes back down. And I'm going to get my fingers, 2 fingers here, and all I'm going to do is I'm going to create that pressure and just a little tension in one direction. Feel with your fingers. You can see with your fingers. A good therapist does not need to look down at their work. You can see and feel with those fingers. And again, I'm creating more tension than pressure. You can feel the nerve go through there. It's not too bad down here for Amanda, but a lot of people, they'll be very tense back here behind the knee where the gastroc crosses the knee joint, the hamstrings cross, and then a great nerve floss for the sciatic nerve, most PTs know this, is, and again, a nerve floss is you're just stretching a nerve through the fascia and through the muscles to provide some stretch to get out of tension of that nerve being compressed would be if Amanda grabbed behind her knee, and then she's going to straighten, extend her leg as much as possible, and then back down. So when she extends, we're stretching that sciatic nerve, and then when she comes back down, she's relaxing. So this is an active stretch to help kind of floss that sciatic nerve. And then the next level, which is difficult for people, it hurts, she's gonna pull her toe back towards her face and then come back down. So we're gonna get some dorsiflexion in there. And that's stretching. Go ahead and pull the toe back. That's stretching through the calf more. Most people's calves are super tight, so that's gonna feel very nervy behind the knee. So that's a great sciatic nerve floss, active stretch for somebody dealing with sciatic nerve pain.